Hi, this report on diabetic retinopathy. What is diabetic retinopathy? Diabetic retinopathy is the most common form of diabetic eye disease and is a leading cause of death in persons with diabetes. It's caused by damage to the blood vessels of the light-sensitive tissue at the back of the eye, the retina. Diabetic retinopathy is caused by prolonged high blood glucose levels. Over time, high sugar glucose levels can weaken and damage the small blood vessels within the retina. This may cause hemorrhages, exudates, and even swelling of the retina. This then starves the retina of oxygen and abnormal vessels may grow. Diabetic retinopathy has two stages. The first stage is non-proliferative diabetic retinopathy. The first signs of non-proliferative diabetic retinopathy are capillary microaneurysms, dot and blood retinal hemorrhages, hard exudates, and cotton wool spots. Cotton wool spots, also known as your soft exudates, are areas of microinfarction of the retinal nerve fiber layer that lead to retinal opacification. They are fuzzy edgy and white and obscure underlying vessels, while your hard exudates are discrete yellow particles within the retina. When present, they suggest chronic edema. Signs in later stages are macular edema and venous dilation and intraretinal microvascular abnormalities. Proliferative diabetic retinopathy has symptoms such as blurred vision, floaters, or flashing lights in the field of vision, and sudden severe painless vision loss. These symptoms are typically caused by vitreous hemorrhage or traction retinal detachment. Proliferative retinopathy, unlike non-proliferative retinopathy, causes formation of fine preretinal vessel neovascularization visible on the optic nerve or retinal surface. Macular edema or retinal hemorrhages may be visible on fundoscopy. Anyone who has diabetes can develop diabetic retinopathy. Risk of developing the eye condition can increase as a result of duration of diabetes. The longer you have diabetes, the greater your risk of developing diabetic retinopathy. Poor control of your blood sugar level, high blood pressure, high cholesterol, pregnancy, tobacco use, and being African American, Hispanic, or Native American. For diagnostic tests, diagnosis by fundoscopy. Color fundus photography helps grade the level of retinopathy. Visual acuity measurements to determine how much central vision has been affected. Fluorescein angiography is used to determine the extent of retinopathy, to develop a treatment plan, and to monitor the results of treatment. Optical coherence tomography is also useful to assess severity of macular edema and treatment. And for the treatment, control of blood glucose and blood pressure. For macular edema, intraocular injection of antivascular endothelial growth factor, drugs like ranibizumab with a brand name of Lucentis, 0.5 mg as a single intravitreal injection. We may also give intraocular corticosteroid implants, focal laser, and or vitrectomy. For high-risk or complicated proliferative retinopathy, panretinal laser photocoagulation and sometimes vitrectomy can be used. For non-proliferative diabetic retinopathy, so regular monitoring may be the only treatment. or we can add injections of medication in the eye. In the early stages of non-proliferative diabetic retinopathy, regular monitoring may be the only treatment. If the disease advances, which occurs in proliferative diabetic retinopathy, the abnormal blood vessels can leak blood and fluid into the retina, leading to macular edema. Laser treatment, photocoagulation can stop this leakage. A laser beam of light creates small burns in areas of the eye of the retina with abnormal blood vessels to try to seal the leaks. And that's the end. Thank you for listening.